Welcome back to the Peptides for Women podcast. I'm Jennifer Woodward, and I am thrilled to welcome to the show Andrea Colon. Now, Dr. Colon is a naturopathic doctor that focuses on integrative and regenerative medicine. She specializes in HRT, peptide and IV therapy, gut health, and metabolic medicine. She's basically the real deal. And we were talking, and she resides in beautiful Newport Beach, California, which I absolutely love because that's where two of my kids are. Welcome to the show, Andrea. I'm happy to have you.
Thank you. I'm excited to be here.
Yes, I am so excited to talk to you. Oh my goodness. Regenerative medicine, HRT, IV peptides. It's all the things that I am so excited to learn about from you. But first, tell me a little bit about the evolution of your own health journey and how you got to the spot where you are today as a practitioner.
Okay, so I originally became familiar with naturopathic medicine when I was in my early 20s. I'm originally from Connecticut, and I struggled with cystic acne. People don't believe me because my skin's pretty clear right now, but it was so bad. I actually went on Accutane, and my skin cleared up, but as soon as I stopped the Accutane, all of it came back, and it was devastating. I mean, I was like, my face is never going to clear up. You know how it affects your self-esteem, especially when you're in your youth. So a friend of mine recommended that I see a naturopathic doctor. And at the time, I was like, what is a naturopathic doctor? I never heard of that. I went to go see her, and she helped me figure out that I had some food sensitivities and some micronutrient deficiencies. And within a couple months of working with her, my face cleared up. So that sparked my curiosity to get more into that field. I started shadowing her and then realized, wow, people can feel better just changing their diet, changing their lifestyle, and taking a couple of supplements most of the time. So that was part of what sparked my interest and journey into the naturopathic fields.
Fantastic. And when did you open your practice?
So I officially went on my own this year. I've been practicing for about eight. I've been working at different group practices in Orange County and then officially went on my own this year.
Congratulations. That is really, really exciting. And who is the general population that you serve with regards to your patients?
It's mostly women. I specialize in hormone replacement and peptides. So I get a lot of the menopausal women and then their husbands also come to me. But majority of my practice is women.
You're like, Dr. Cologne, why is my wife looking so amazing? Tell me what you're doing. I want to do it too.
Oh yeah, that's the best referral.
Yeah, it is. Now, you start with hormone replacement therapy. You start with, testing women's hormones and seeing what are some of the underlying deficiencies that might be cropping up before you probably even go to peptides. Tell me about that process of what you would walk a woman through and some of the foundations that have to be in place before you move into a peptide journey.
Right. So a big part of what I do as a naturopathic doctor is focus on the root cause. So a lot of it is focusing on foundational medicine first. So I always start with a really thorough intake. I want to know the health history, family history, kind of all the symptoms going on. And then I always start with blood work. I want to know it's not just about hormones, it's about what's going on metabolically a lot of the times for these women. So, what is their iron levels? What are their inflammatory markers at? What's their blood sugar, cholesterol, thyroid? Those are all tied in. So, I start with a lot of diet, lifestyle, stress management, and then adding on peptides and all those things as extra tools to help them feel better.
I love it. I love it. Now, you also have been using peptides for quite some time personally, which I think is so fun because there are so many people who've probably been using them longer than we think, just haven't been talking about them. So it's been
Right.
a 3-year journey for you, right, with regards to some of those GLP-1s. Will you talk about it a little?
Oh, yeah. So I was probably one of the first doctors to start the GLP-1 journey. I brought it onto my old practice because I always want to try things before I recommend them to my patients. I want to know how do they feel and do they actually work? And I was a little skeptical at first because there's so many weight loss drugs out there. And I like to try all of them, and I'm like, okay, I'll try it. So I started with semaglutide personally, and I started losing weight. At the time, I was using an InBody, which is a special scale that will determine your muscle mass and body fat and all of those. And I was working out and realized, okay, I'm losing body fat. I'm not losing muscle mass. And I did it for a period of 6 months. I did feel sick, but I stuck with it because I was losing fat. So I was like, okay, I'll take it, I'll sacrifice myself for this. But within a 6 month period, I lost 30 pounds of body fat and I kept it off afterwards. And I was like, this medication is fantastic. Like some of my inflammatory markers. So I was dealing with inflammation at the time that I figured out was from my gut. But like saw my cholesterol improve, some of my inflammation was going down. So I'm like, okay, maybe there's something to this medication. Then I started recommending it to patients and realized, wow, this drug actually is really, really great for not only fat loss, but some of my patients got pregnant on it that weren't expecting it, improved fertility, it helped with pain. It helped curb those cravings, especially for my patients that drank alcohol. So I was starting to see all these other benefits to it. And I think, there's going to be more coming out soon, but I think those medications are great when they're used properly.
Absolutely, they are. And great for the subset of the population that you work with, women who are in midlife, who are probably like pretty dialed in. They eat a pretty healthy diet, exercise fairly regularly, but just cannot lose that last bit of body fat or even the first bit of body fat. And they're really, really inflamed. So have you seen that story kind of play out among your patients, that kind of repetition of your own story?
Oh, absolutely. And, I feel for them because I understand when you are working out and you're eating well and you're not losing weight, how frustrating it is. And it's unmotivating. So I put women on these medications to jumpstart them, jumpstart their weight loss while we fix the labs, while we correct their lifestyle, because that's when they get the long-term success. And eventually they get off of it. And I want to set them up to have a healthy lifestyle so that they don't gain all of the weight back at the end.
I think that's fantastic. And I like hearing different practitioners' viewpoints here. Some think that, their patients should be on at least a microdose of a GLP-1 for a long time, but it sounds like you are working with your patients to eventually transition them off a GLP-1. So walk me through that process.
So I do have patients that do a microdose, and again, everybody is different. So some people respond well to the microdose and some don't. Some people need the full dose. I do have a couple patients that they just stay on a very, very small dose to cut out that food craving. They don't necessarily need to lose more weight. And sometimes they're not even injecting once a week anymore. They're doing every couple weeks, and that's worked for them for a while. And as long as we're monitoring their labs and they're not having any negative symptoms, I'm fine with them doing that. But eventually, my goal with the patients I tell them is to have them be on this for a couple months and then get them off ideally.
hmm And what are some of the things that you're working on from a lifestyle perspective with them in the meantime to set them up for success after transitioning off?
The biggest thing, you have to work out. This is not a magic pill, right? So, and again, slow and steady because you don't want to lose 20 pounds in a month. That's likely going to be muscle. And that's when the drug gets a bad rap because you see people that are skinny and frail, and it's like, okay, they're overdosing. They're probably not working out. So we have to get women lifting weights. I know there's still this stigma about being bulky, but that doesn't happen if you're just doing 5 to 10 pounds in the gym. So working out, sleeping, working on stress management, and that's where the balancing hormones comes into play with that for sure.
Right. So, how often are you running labs with women with regards to hormones, and what are some of the therapies that you're fond of with your midlife women?
So a lot of my patients, I'm really thankful. I have a big crowd that wants to optimize their health. So some of my patients are on a 3 month retest. I'd say on average, most are on every 6 months as long as they're feeling steady. And again, it's monitoring not only just hormones, but inflammation, blood sugar, all those other things that will affect the hormones. And then, sorry, what was the other question?
What kind of therapy are you using? Do you like estradiol patches? Are you using bias? Do you do testosterone injections or pellets? Tell me about your
So
practice.
I offer in my clinic, I offer all types of hormone replacement. So I do pellets, I do creams, I do patches, I do oral, I do injections. To me, it's about the patient. I sit down and explain these are the options, what works best with your lifestyle, because it's really about the patient at the end of the day. And I give them my input about, I don't like oral estrogen, for example. I usually try to have people do either the pellets or a topical patch or cream. And we can always switch. I tell them if they hate it after a month, we can switch to a different form. But it's really about the patient for me.
Absolutely. Yep. And it really is difficult. I mean, we live in California. It's kind of easy to get quality care in California just because people are a little bit more open-minded. A lot of open-minded practitioners come and practice in California. Do you have recommendations and advice for women that live in more rural areas or areas where they don't have access to quality functional medicine doctors?
I know it's very difficult because even, I'm from Connecticut and I feel like they're so behind with health over there. That was part of the reason I moved to California because everyone's more open to being optimized and about preventative medicine out here. So I think the best thing you can do is if it's licensed there, find a naturopathic doctor or a functional doctor that specializes in hormone replacement, optimizing your health, functional medicine, those kind of things, because they'll be more on top of the latest trends and just keeping you healthy overall.
Yeah, absolutely. And optimization, I think, is a fantastic word because you love talking about all kind of states that can be modified with peptides. And so we have talked a little bit about weight, but what about energy? What are some of the things that you're doing with your patients with regards to peptides and maybe lifestyle to increase energy?
Okay, so this is where we start with foundations, right? Because this is really common I see with women. Iron is off. That's a big driver for low energy I see. And most women, their iron is not optimized. Low ferritin, I see this commonly, or suboptimal ferritin is a big cause for fatigue in women. And then when we get more into that stress component, I don't know anyone that doesn't have stress, honestly, and it affects women way more than men I see in my practice. Stress will affect all of our hormones. It affects our thyroid, our blood sugar. So cortisol is something I'm always looking at. And I know there's all this talk online about you need to lower cortisol, but that's such a small percentage of people that I see. The menopausal women I usually see, their cortisol is completely depleted. That's like a chronic stress. Their body's not adapting. Those, and then other things commonly I see low vitamin D. Most population have low vitamin D. That's another driver for fatigue. So those, along with the hormones and the thyroid, like balancing those, and then I'll give peptides or IVs on top of that to help speed up the recovery.
Mm-hmm. Mm-hmm. What about sleep? Are there interventions that you'll use for sleep? Are you a fan of the growth hormone secretagogues? And what are some of the actual lifestyle things that you're doing in your practice?
So I do prescribe the growth hormone analogs. And again, they work for some people and not everybody because not everyone has low growth hormone. So I check that on labs, right? And I do use the CGC, Upamorelin, Cimarelin. I've tried them all. Again, personally, I like Cimarelin and troches. Sometimes I get needle fatigue doing 5 days a week, but some of my patients don't. So I think that they can work well for some patients. I think honestly, sleep is one of the hardest things to treat because there's not a one size fits all for that. Because sometimes it's like, okay, sometimes it's a hormonal issue, progesterone or pregnenolone are completely depleted. So that person needs support there. Or again, there's a cortisol dysregulation. So, um, there are peptides for sleep I've been using. The Dissip I really like that. And then again with the growth hormone analog. So I kind of play around. And I tell my patients again, we can try one thing. Like if magnesium and melatonin aren't enough, we can try these different peptides. And if it's not working within a week, there's other things we can try.
I really like that timeline. If it's not working within a week, then there are other things that we can try because at this time in life, we are just weary of things not working. And that's, I think, one of the beautiful things about peptides is that they accelerate so much of that healing process. You can see the effects very quickly. But you're right, not all of the time with sleep. And that's something else I love about functional medicine is it's so multifactorial. It's not just like slap a peptide on and your sleep's going to get better. That's not necessarily the case. There are a lot of other things that you need to be looking at, including hormones, like you said.
Right. And stress management is huge because how many women do you know that are working late at night and they're taking care of their kids? They're just not sleeping, period, because they're busy getting off the phone, not watching TV. It's like simple things like that we need to remember too.
Yes. Yes, I know a lot of women like that. I struggle not to be that woman myself too. It's really hard. It's really hard at this time in life. So, yeah, getting a lot of those basics in place first is going to be helpful for sleep. And not just sleep, but libido. So I've been experimenting with the libido peptides. I really love them. They don't work in the way I thought they were going to work, and it seems like they will affect my clients in different ways. Now, personally, I mean, I've been fairly happily married. I mean, like happily married, of course, but like in a normal relationship for 25 years. And so it's not like I want my libido to be sky high, but it's definitely helped a lot in a lot of areas. So give me some of your thoughts on some of the peptides for libido.
Were you trying the PT-141?
Hell yeah, girl.
Yeah, I've tried that one. Did you get the flush from it? Because that's people are like, I'm having a reaction. I'm like, no, it's a natural vasodilator. So
I did try it three ways. So I used a troche, I used a nasal spray, and then I finally used an injection. With the injection, I got more of the side effects, a little bit of flushing and some nausea, but with the troche and the nasal spray, I didn't. So I'm
yeah.
probably going to stick with the troche. I think that was my favorite.
Yeah, I usually find that the troche is a little bit better for my patients because I think people get turned off when they're turning red. I've had people think they're having a reaction. I'm like, no, it's just vasodilating. But that one I've experimented with an oxytocin. And again, it's I think that they're great for some people, but some people don't respond to them. So it's kind of like a trial and error thing to see which ones work for patients and which ones don't.
Yeah. And I think that goes back to that root cause, like functional medicine, functional nutrition is there really is not a one size fits all for any symptom either. It's not like snorting something is gonna, snorting a peptide. Let me be very clear. It's not like snorting a peptide is going to fix your lack of libido. If you're up until 11 and you're stressed out taking care of your kids and your aging parents and you don't feel good about your body and you haven't eaten enough protein, it's not
Right?
PT-141 is not going to fix that. But if you're fairly optimized, it can start to enhance just a relatively low libido.
Exactly. And that's why I like to look at all of the hormones too and not just spot treat because if any of them are off, it can affect libido, not just testosterone.
Absolutely. Okay, let me ask you a question as a naturopathic doctor. I have this talk with my colleagues sometimes. She swears that just going on testosterone gave her a better libido. And I said that I've rarely seen in my practice when women go on testosterone that that's enough to enhance libido. I think that she already had some sort of libido and it just kind of like accelerated that. But I don't know. So that's why I'm asking you, what are your thoughts on that?
No, I would absolutely agree with you. And the same thing for men too, but for women, it's not, it's just testosterone is well known for libido, but that's not the only hormone that affects it because pregnenolone, DHEA, those being off will affect your libido also. Cortisol will affect your libido. So there's other hormones too that are responsible. So I agree. If I don't ever put women just on testosterone because when I do, it's not usually just a fix for the libido.
Sure, sure. Yep. Yeah, interesting. I do like DHEA too. I'm a non-licensed practitioner, so that is one of the hormones that I can legally work with. And so getting women a little bit of DHEA, especially if I see it low on their Dutch test, can be really helpful, just kind of for that resilience factor that allows them to feel like they have a little bit more energy or they're more resilient to stress. I mean, pregnenolone as well, I can work with as a non-licensed practitioner. But I'm definitely going to hit the foundations first just to make sure that they feel like they're in a safe and well protected and nourishing kind of environment before some of these sleep issues and libido issues and energy issues can really start to get fixed, right?
Yes, exactly.
Yeah. Let's talk a little bit about gut health too. I mean, or maybe a lot about gut health because that's going to be so foundational for so many women. So what are some of the things that you're doing in your practice with your patients to dial in gut health?
So I think most people have digestive issues. And it's interesting to me how a lot of people think that not going to the bathroom or having loose stools or bloating or gas are normal, and they're not. Like you should be going to the bathroom regularly every day and you should not have loose stools. I have to say that because most people I see think that that's normal. And I'm like, no, it's not. So I do gut testing in my office to look at bad bacteria, gut inflammation, digestive capacity, parasites, all of those things. And most patients I see have some gut dysbiosis and gut inflammation going on.
Mhm. Yeah. Are you using anything like BPC 157 or TB 500 to dial in gut health? And do you do the oral or injectable form?
So for patients that have a lot of digestive issues, I'll use the oral BPC 157, and I also have one that has the KPV in it, which is another anti-inflammatory. Patients that have Crohn's, especially, or UC, ulcerative colitis, do really well with those.
Okay. Yeah, my husband is obsessed with KPV. So he's like, "Did you get a new shipment of KPV yet?" Because now that we're all into peptides, he's always getting, things from YouTube Shorts or something
Oh
talking about
yeah.
KPV.
I've been using the injection, and I will tell you, from my personal experience, I haven't tried it out on patients so much, but it got rid of my menstrual cramps.
Hmm.
And I was taking just to give you an idea, 800 milligrams of ibuprofen. Like I think I have endometriosis. I just haven't had the surgery, but the KPV has minimized it completely.
Interesting. What do you think that MOA is? What's happening there?
It's supposed to, I mean, it's an anti-inflammatory. So I've tried all of them, but I'm like, let me just try this one. It was my last hope and it worked. It's been working for me. Thank God. Knock on wood, but I'm gonna keep doing it in a couple more months before I start recommending it for that specifically, but we'll see.
Oh, that is amazing. Because being off those anti-inflammatory, I mean, the Tylenol or ibuprofen is definitely
Horrible.
helpful for your gut health.
Oh yeah, I hate taking it, but I think I have endometriosis. I just never got, I don't want to get the surgery. I've been trying to postpone it, but um yeah, I'm like if these peptides get rid of anything, it's going to be a game changer for a lot of women.
Yes, that is amazing. Okay, good stuff, Dr. Claude. I like it. Okay, and then what about skin? So, I mean, we're in women's business, right? Like women
Yeah.
want healthy hair, skin, and nails. That tends to be a big driver too of like women seeking out help when they feel like their skin is aging too quickly, like face skin, hand skin, neck skin, whatever, or their hair is falling out. They get real
Yes.
upset real fast. So, what are some of the things that you work with women on in that respect?
So again, if we're going to do foundational things, what are their hormones? What are their iron levels? What's their inflammation? Those are the big drivers for skin, hair, and nails I see. Peptides, I find, can be really helpful for that added boost. One of my personal favorites for anti-aging is NAD. I don't know if you take that, but
Yes. Yes, I do.
that's my favorite peptide, I think, overall. I just notice in my patients and myself, my skin is glowing, energy is so much better, my mental clarity is so much better, just instantly. I do the IVs when I have time, but I hate sitting for that long. So the peptides are great for that because it's just 2 to 3 times a week. I have a lot of patients on the Glow Blend, which is like the BPC, TB500, the copper peptide, and they have one with KPV in it too. That I'm noticing some of my patients, like their skin is, they're looking younger. I've had a couple of them on it for a couple months, so I'm like, okay. I just started that one, so I haven't seen the full effects of it yet, but I'm excited. So it's amazing what peptides can do.
It is amazing what peptides can do, 100%. So what are some of the future uses of peptides that you are excited about in your practice?
So again, I think when I was talking about the GLP-1, seeing patients that were having trouble getting pregnant, because you're lowering that inflammation and that's improving in the background their hormone health. So I think they're going to find, just like with the GLP-1s, that these peptides have other uses that they're studying. Like I treat a lot of cancer in my practice too, and they're coming out with studies now that are showing like the cancer risk is going down with patients that are doing GLP-1s again because it's lowering inflammation. So I just think that they're going to keep coming out with more research about the more benefits of what these peptides actually do.
That is exciting. I mean, anything that can reduce our risk for cancer is thrilling, right?
Yes, I would agree.
Mhm. Yeah. Okay. And then do you have a couple stories from your practice, like particular patients, obviously don't use names, where you've really seen peptides enhance a lot of the work that you've already been doing together? Or maybe there was a roadblock that you couldn't get over with the patient, added some peptides and something amazing happened. Can you think of anybody like that?
So I think about like NAD, for example. I've been using it a lot with like chronic viral infections or post-COVID. I just had a patient that she had come to me because she couldn't even get out of bed. She had to quit her job. She was so sick. And I used like NAD and one of the antiviral peptides on her, along with like balancing her hormones and everything. And within a couple months, she was back to the gym, back to work. It was like night and day difference. And she had been suffering for a couple of years prior to this.
That
That
is
and then again, just back to, with GLP-1s or tirzepatide, any of the GLPs where these patients, I had a patient that just lost 150 pounds, motivated, going to the gym. I should have taken a before and after picture because it's like they're going to be doing their first like triathlon now. So I'm like, they got motivated to be a fitness guru. So I'm like happy with them.
that is amazing. The stories are so cool. And it's not like that's cheating. That person is still doing all of the things they have to do in order to lose weight. But finally, I mean, that insulin resistance is reversed. The glucose numbers start to come down, inflammatory markers start to come down, and the body can finally do what it's supposed to do, get back to normal weight homeostasis. I think that's beautiful.
Yes, and just a couple of the patients I have that not that I wouldn't say they were alcoholics, but they, liked booze. And I'm like, this is hindering your health. Like your liver enzymes are high, your glucose is out of control, and the peptides have helped curb that craving for them so they're not drinking excessively. And again, metabolic health is improving on their labs.
Beautiful. So cool to see. So it's not just food like that makes us healthy, that reduction of other substances that can really impair, like you said, just glucose in general or inflammatory markers or gut health is exciting. And I know even there is other research where GLP-1s are being used for other forms of addiction like gambling or narcotics, where the research is really
Oh.
promising, very exciting.
It's amazing. That's why I said I think they're just going to continue to come out with benefits of these peptides.
Yeah, I think so too. In fact, I was talking with Dr. Dean Jones on one of our past Peptides for Women podcast episodes, and we were talking about some of the reduction of addictive tendencies with the introduction of GLP-1s. And I said I was still waiting for it to help with my shopping addiction. He said, maybe you just like to shop. I've been
I
thinking
know.
about that a lot, and it's probably true.
Pick and choose your battles, right? It's like
I'm fine not drinking wine, but I really like to go shopping.
that's okay. Good reason. Yeah. It's like you're getting sleeping.
Yes. Okay. So walk me through your personal current peptide stack. What are you really excited about right now? What are you using on the day to day or perhaps the week to week?
Okay, so I'm on my cycle. I either do semaglutide or tirzepatide. I'm back on my cycle right now because the holidays, I was I was bad. I went on vacation this weekend, but I do that for the holidays, just low dose, just to get me through, so I'm not eating sweets and everything. I take NAD. I just started the Glow Blend again because I had some shoulder pain from because I started doing yoga and I have a prior injury, but that's been taking care of it for me. What else am I taking? LL37, which is an antiviral. I just started using C-Max Solank nasal spray.
Yep, I'm
It
taking
helps
it
with
too.
my mood. Yes. I like it a lot so far.
I do too. I do.
I always I'll take oxytocin occasionally too. I'll take I like the blends because I don't like injecting too much. And then I just started the oral BPC KPV just to see if I notice anything with my digestion.
All right, kind of keep in touch and let me know because I'm curious about that. I've been switching back between the injections, BPC 157, TB 500, the oral form, BPC 157, TB 500. My problems are definitely more GI than systemic inflammation, and so I'm waiting to see the jury's still out.
You'll probably like the oral one.
Yeah, yeah. It's definitely easier to take. I mean, I'd prefer a pill to a shot, even though I don't really mind injecting my peptides. It's nice to take a pill.
Yes, I know. I think the injections are superior if you're dealing with injury, recovery, or repair.
Yeah, yeah. I wanted to ask you too, just about the difference. So you mentioned that you went back on just a little maintenance dose of your GLP-1 for the holiday season. And that's a question I get asked a lot and something that I think every practitioner has a little bit of a differing opinion about the difference among the GLP-1s, right? So semaglutide, GLP-1, tirzepatide, GLP-1 GIP, and then retatrutide, not yet FDA approved, GLP-1 GIP and glucagon inhibitor. So what have you seen with your own patients or maybe experienced yourself? I've used all three and I've landed on tirzepatide, but I like to hear everyone else's, thought process and explanation.
I've used all three also, and I think tirzepatide has been my favorite so far. I just started experimenting with the butriptide, so I'm still seeing how that works out. But I think as far as effectiveness and the side effects, tirzepatide is a little bit better than the semaglutide. I think a majority of patients I see, and this happened to me even, semaglutide causes more GI issues, like more heartburn, constipation versus the tirzepatide and even the butriptide that I've seen so far. So I will
Mhm.
typically tend to start patients out more on the tirzepatide right now, just because I've seen I've seen the effects of that long term versus the Regenerative because that's still newer. Um,
Hmm.
it's interesting though how it affects everyone so differently, right? Because I still have a couple patients that are on semaglutide and they're totally fine. They don't have any GI issues. And I have a couple patients that don't tolerate tirzepatide. So everyone, it's just everyone's body responds differently.
True. And it is nice that there are a couple different options available to people so you can experiment and see if one doesn't work well. Maybe you try one of the other ones.
Exactly. I think generally, this is just in my practice. I have found that on patients lose more weight at low doses of semaglutide versus tirzepatide,
Interesting.
but they get more side effects. I find that
Hmm.
some patients need more tirzepatide to get the weight loss generally, but not everybody. But that's what I've noticed so far.
Oh, what do you think is behind that? That's very interesting to me.
Yeah, I just think it's everyone's body responds differently. Yeah, it's been interesting because I was expecting when I first started using tirzepatide, I was going to get more weight loss because it's a GLP-2, but that hasn't always been the case. Some of my patients need to
Yeah.
be on the medium to higher doses before they start getting the weight loss.
Okay. And what doses are we talking about with medium to high? Is that like 5, 10?
Yeah, I'd say like 5 to 7.5. I've had a handful of patients that didn't get any weight loss until they were at those doses.
Hmm. Yeah. Yep. And that definitely comes with more side effects or can come with more side effects.
Yes, the constipation you have to watch out for. And I tell it's important for them to know too, it's not again, they shouldn't be expecting to lose 20 pounds in a month. That's not healthy. So as I'm like, commit for 3 months and let's see where you're at.
Yeah. Man, dang you, constipation. Why do you have to be a thing? My life would be
Yeah.
perfect if I could just be on a microdose of tirzepatide and not have constipation.
And
Is
some
that too
patients
much to
are
ask?
fine. Yeah, I know. Some people are fine, but some are not.
Yeah, no, it's true. That's literally just me. But I have not seen actually a ton of those GI side effects, especially with a lower dose of tirzepatide, like 2.5 milligrams, sometimes even a little bit lower. Most people will get a decent amount of weight loss and really not have a ton of side effects. Sometimes low energy, sometimes a headache. Some people don't even respond well to a small dose, a microdose of tirzepatide or semaglutide, but I'd say 95% of people do.
I find the people that respond the best to microdoses are already working out. They're eating pretty well. Like those patients respond the best.
Yep, you got to be tapped in. That's definitely helpful. And I think it's starting to change the face of how people are looking at some of the GLP-1s because more people who are, living a better lifestyle, like they've just been working on their lifestyle for a period of time, or they have the knowledge, or they're working with the practitioners helping them. It's nice to see that people are starting to see, okay, it's not cheating. People are still putting in the work. They're eating their protein. They're getting their steps. They're getting their stress management tools in, and that's how, they're really looking and feeling good instead of kind of spent, or that melting candle look of too high of a dose of Ozempic.
And yes, I think there's a misconception because the drug is not used properly. Like I've had a handful of patients come to me that were getting prescribed these crazy high doses right away. And I'm like, more medication does not mean more weight loss. And I'm like, this is why you're so sick and why you're losing all your muscle mass. So I cut them back to a manageable dose and they're fine. But no one should be getting put on these crazy high doses right away. And that's when you have to worry about those severe GI issues, right? Like I've had several hundred patients on this easily. None of my patients have had pancreatitis or any of those crazy hospitalizations, thank God.
Yeah, you're doing it the right way, and you're making sure that their lifestyle principles are dialed in while they're working alongside you and adding in those peptides just to really mitigate any of those possible, negative effects, right?
Yes.
Yeah.
Yes. Working on making sure they're using the bathroom regularly because it's like, yeah, if you have all this constipation, then you give someone something that's going to constipate them more. That's a recipe for disaster too, right? That's why people shouldn't just be blindly buying these things online. You have to make sure you're monitored by a professional.
Yes, please. And let's talk about from a professional perspective why research peptides are not necessarily the best thing for people.
There, you know, there's so many people online just selling peptides. I see this. This is my pet peeve. I just had a friend talk to me about this yesterday because they went to it was like some webinar thing where the person was selling peptides and they didn't have any training, right? Let's just put it that way. And the person I know has a history of cancer, and this person was telling them to take a copper peptide and NAD, and I'm like, no. this is so dangerous. I'm sorry. Like, I don't like to badmouth anybody, but I'm like, what you're doing is negligent. And with the research peptides, you don't know where they're coming from, right? They're technically not approved for human use, and a lot of people are recommending them online. And they're going to crack down on it, I think, probably next year because you can't just, everyone's selling them and buying them from, and they don't know what the health history is. That's what scares me, or what the lab work looks like. Because you
Yeah,
have no
that is a
idea.
little terrifying.
Yeah, you can't.
Yep.
There's still, you need to have regulation with it to an extent.
I hope there is some sort of level of cooperation, though, between companies who are making reputable peptides, even, quote research peptides and government agencies, because so many people don't have access to quality practitioners. They don't have access to people who are knowledgeable about peptides. And so they think, well, I'll just try to do the best I can and, might make a mistake. I mean, that's not necessarily a good thing. Sometimes I'll type in, peptides into Google and rarely do I see the same company come up when I look at, Google images. There are new peptide companies all the time. That's kind of terrifying.
Yes. And with those, I think, the best thing you can do for yourself is make sure they have a certificate of analysis, at least to
Mhm.
make sure they're not putting junk and contaminated stuff in your body. I mean, if you're going to go that route. But I know some of my patients are like, oh, I could get this cheaper online. I'm like, yeah, but you don't know where it's coming from. It's probably coming from a factory in China. Like this company, you could tell by the packaging, it's not even legitimate. So, and the dose, the milligrams are usually pretty like lower than what I can get.
Whoa.
But
10 milligrams for $200, even $100 at 10 milligrams. That's going to last you maybe a week, maybe 2 weeks. Then you have to buy your needles and your backwater. It's not doctor approved. It's not doctor prescribed. Like they're just cheaper is not necessarily always better. Taken from someone who was raised by a very frugal woman. So I understand, wanting to save a dollar, but when it comes to my health and longevity, especially with something, as powerful as peptides, I definitely want to be careful.
with something that you're injecting, yes, you want to be careful.
Yeah, it's something that you're shooting into your body, 100%.
And then it's just being educated too, because I have patients. This is another example. I had a patient recently that came to me. They were injecting 5 growth hormone analogs because someone recommended them to them. And I go, what are you doing? No, you don't need this much. You're 35 years old. You're going to give yourself cancer. Like, no, more is not better.
Oh my goodness. Yes. Okay. Well, that is why, I mean, really, that's one of the reasons that I have this podcast, just so women can get more educated. None of this stuff, and is the be all and end all of peptide education, but for women to have more access to qualified practitioners, knowledgeable practitioners such as yourself is very helpful because people are talking more about peptides. I mean, the swell is just starting, and obviously everyone is curious and everyone's going to want to, try it, either an early adopter or a late adopter. And so having access to practitioners who are helpful and educated can really save you a lot of heartache and possible side effects in your peptide journey.
Yes, exactly. And everyone is on them. Everyone's asking me. People you wouldn't even think want peptides. And I'm like, okay, it's a good thing again when they're used properly. I think it's great.
Yes, yeah. When my mother-in-law is using peptides, I think, oh wow, like this has hit mainstream. Yes. Okay, so Dr. Colon, this is such a joy, such a great conversation. I love that we're kind of close in proximity too. I might be headed down for NAD infusion here sometime in the future.
Yes, I do them. I do them once a week at least. I love it.
Sounds great. So tell us where people can find out a little bit more about you and your practice.
Yeah, so I'm located right in Newport Beach. On it's 1100 Quail Street. And you can look me up on my website. It's www.drandreacolon.com or find me on Instagram. It's at Dr. Andrea NMD. You can shoot me a message or you can call or text my office. The number is 949-423-3522.
Thank you so much, Dr. Colon. And do you have any closing thoughts for women on peptides?
So again, I think being your own advocate and peptides can be one tool, but really getting the foundations down. So be an advocate. Ask your doctor for the blood work. Get your hormones checked. Get your inflammation checked. Get your micronutrients checked. You want a baseline so we can correct all of those and use the peptides as a tool to make you feel optimized.
Beautiful. Thank you so much for your time today and your wisdom. And thank you to everyone who is listening to the Peptides for Women podcast. We appreciate it, and we'll see you next time.
Thank you.